Hello everyone, this is Zhou Jingyi. Today I'll be talking about one of the diseases you might fear the most, dementia. Do you think it's something everyone gets as they get older, or something that only happens if you're unlucky? In fact, the world of medicine is currently undergoing a major overturning of conventional wisdom. In 2024, a major announcement was made. The globally authoritative medical journal The Lancet released a report that has sent shockwaves through the medical community. It stated that nearly half, approximately 45% of dementia cases can be prevented or delayed through controllable factors. 45%. This is a staggering number that changes everything we thought we knew about cognitive decline in old age. Dementia is not a storm that suddenly strikes in old age. It is often the result of years of cumulative preparation, or lack thereof. This report gives us a roadmap. By identifying these 14 controllable risks, we can take back control of our future brain health. Prevention doesn't start at 70. It starts in our 40s and 50s. Every choice we make today builds the fortress of tomorrow. We are moving away from the era of hope and into the era of science-based prevention. Let's dive into what this actually means. Today, I will walk you through these 14 lists and show you how to protect your brain starting from your 40s. We'll discuss analogies like the brain as a port and why even your vision matters more than you think. And we'll look at why bad cholesterol is more than just a heart issue. It's a direct threat to your memory. This information comes from the best minds in neurology. It's time to update our common sense. Are you ready to learn how to save your brain? Let's begin our journey through the 2024 Lancet report findings. Previously, we knew about the core risks. Hearing loss, high blood pressure, smoking, and diabetes have long been on our radar. But the 2024 report adds two critical new factors: vision loss from untreated visual impairment and high LDL cholesterol. You might wonder, why are poor eyesight and cholesterol related to the brain? The connection is biological and profound. Imagine this. The brain is a port for taking in information. It thrives on constant stimulation and data from our senses. If eyesight deteriorates and isn't treated, the amount of information entering the brain decreases drastically. Ships stop coming. When the ships stop, the town, your neural network, loses its vitality and begins to decline. Use it or lose it applies here. Then there's LDL cholesterol. Think of it as garbage blocking the roads that lead to your brain's port. It clogs blood vessels and hinders the vital blood flow required for brain cells to survive and function optimally. These are part of the 14 factors. Each one is a lever we can pull to strengthen our brain's resilience against disease. Managing these risks specifically in midlife, our 40s and 50s, provides the strongest shield for our long-term health. It's not just about one factor, it's the cumulative effect. Small changes in vision care and diet add up significantly. Untreated vision loss is now recognized as a primary target. Regular eye exams are no longer just for convenience. They are for your brain. Likewise, keeping LDL cholesterol low isn't just for your heart. It ensures the highways of your brain stay clear and fast. We must also remember hearing loss. Like vision, it's a sensory gateway. Closing it prematurely starves the brain of needed input. Managing hypertension in midlife reduces the mechanical stress on delicate brain vessels, preventing microdamage over decades. Smoking remains a major risk, introducing toxins that accelerate cellular aging and vascular damage across the entire body. Early life education is also on the list. It builds cognitive reserve, a buffer that helps the brain handle age-related changes better. Social isolation is another key risk. Staying connected keeps the brain's social circuits active and resilient. Late-life depression is linked to higher risk. Managing mental health is a core pillar of dementia prevention. Diabetes management ensures the brain has a steady, healthy supply of energy without the damaging effects of high blood sugar. Physical inactivity and obesity are also on the 14-point list. Movement is medicine for the neurons. Understanding these factors is the first step. Next, we'll look at why so few people are actually taking action. Let's look at the latest data from a 2026 survey by the Alzheimer's Disease Association. The results are eye-opening. While almost everyone over 40 agrees that brain health is vital, only a tiny fraction actually know the specific steps to take. This is the knowledge gap we are currently facing. We have the desire, but we lack the clear, actionable roadmap. In the United States alone, an estimated 7.4 million people are currently living with Alzheimer's disease. Many people want to help themselves, but end up wasting time on unproven methods instead of the core 14 factors. Gaining the right knowledge and taking action now is the greatest gift you can give to your future self. This isn't just a local issue, it's a global shift in how we approach aging. Awareness is rising, but implementation lags. The 2026 survey found that many still believe dementia is entirely genetic. This misconception stops people from trying. When people learn that 45% is preventable, their motivation levels skyrocket. Knowledge truly is the catalyst for change. The over 40 demographic is the most critical window. This is where habits are formed that dictate the brain's future trajectory. The survey also showed that while puzzles are popular, they are less impactful than managing physical health like vision and cholesterol. We must break the stigma of talking about cognitive health early. It shouldn't be a scary topic, but a proactive one. Doctors are now being trained to use the Lancet report as a checklist for their patients in their 40s. Ask your doctor about it. Ultimately, the survey highlights that the responsibility lies in education. You are the CEO of your own brain health. Community and social support make these lifestyle changes easier to sustain. You don't have to do this alone. By 2026, we hope to see that 20% knowledge figure climb much higher. Every person reached is a potential life saved. Education is the bridge across the knowledge gap. By watching this, you are already ahead of the curve. The reality of knowing but not doing can change today. Let's make doing the new common sense. Empower yourself with these facts. Next, I will give you my honest interpretation as a doctor. It's important to balance hope with clinical reality. Let's discuss the nuances of the report. The survey is a wake-up call. It's time to turn awareness into a concrete plan for every 40-year-old. Now, let's look at the medical interpretation of these statistics. Here, as a doctor, let me add a slightly formal but important supplement to the statistics we've discussed. There is a possibility of prevention does not mean it can be prevented 100% completely for everyone. There are aspects of dementia, such as genetics, like the APOE-E4 gene, and the natural process of aging, that remain beyond our control. However, what this report indicates is the hope that the onset of the disease may be delayed by 5 or 10 years. What if something that was supposed to develop at age 80 could be postponed until 90? That is a decade of quality life. Based on observational studies, this list of 14 isn't a magic wand, but it's our most reliable map for the journey of aging. The data comes from decades of tracking thousands of lives. The link between these habits and brain health is solid. Every brain is different. What works most effectively for one person might vary for another, but the 14 factors are the best baseline. We are talking about risk mitigation. We can't eliminate the risk, but we can significantly lower the odds in our favor. Midlife is the critical window because this is when the underlying pathology of dementia often begins, decades before symptoms. Protecting your heart and blood vessels is essentially protecting your brain. The two are inextricably linked. Every brain is different. What works most effectively for one person might vary for another, but the 14 factors are the best baseline. We should also consider stress. Chronic high stress and cortisol levels can be neurotoxic over long periods. Sleep is another vital factor. It's when the brain's waste clearance system works hardest to remove toxic proteins. Nutrition provides the building blocks. Antioxidants and healthy fats are the literal construction materials for neural health. As a doctor, I see this list as a holistic approach. It's about how you live, not just what pills you take. It's a message of empowerment. We are not helpless. We have 14 powerful tools at our disposal. Now, let's summarize what you can start doing today to maintain your brain for the next 20 years. Now, you don't need to tackle all 14 items on the list at once. That would be overwhelming. First, check your LDL cholesterol level in your latest health checkup results. It's a simple, measurable starting point. And if you've recently noticed difficulty seeing, don't hesitate to visit an ophthalmologist. It's for your brain too. These seemingly obvious things are actually sophisticated brain protection activities. Don't underestimate them. Dementia prevention isn't something you start in your 60s or 70s. It's a lifelong commitment. Your habits in your 40s and 50s will shape your brain 20 years from now. You are building that future today. I will continue to share the latest findings in an easy-to-understand way so that you can all live long, healthy lives. May today be the best day for your brain. I'm Dr. Zhou Jingyi. Thank you for watching, and goodbye.